Hi, I'm Dr. Rovetti. We're going to answer the question, do you have a rateable impairment of your lower extremity, includes your hip, knees, ankles, and feet? Other than the very obvious ones, such as any type of surgery, like a hip replacement, knee replacement, any type of an amputation, your toes cut off, obviously have a rateable impairment. But there's some other less known ones, and let me show you that. Starting with the feet, if there's a decreased motion of this big toe, it's a rateable impairment. And interesting enough, decreased motion of these lesser toes, say they just won't bend as far as the other one because of the injury, that's really not a rateable impairment. Fractures of the metatarsals, which is all these bones here, that's sometimes a rateable impairment. It has to be accompanied by an inability to put full weight on the foot. And so sometimes they fracture, they heal correctly, no problems with walking, and they could, that's really not a rateable impairment. As far as fractures of the ankle, if they heal but they're not healed in a perfect manner, then it's possibly a rateable impairment. Range of motion of the ankle and the hind foot is a rateable impairment, and the motions on that is going back as far as you can, go ahead and do that, and forward, and then there's inversion, which is this, and we measure the ankle with her laying face down, and then we go the other way. And if you suspect you have a rateable impairment of your ankle because of a really bad sprain or a fracture that healed correctly, but you still can't move the ankle as well as before, of course compare it with the other side. If you have a good ankle on the other side, and if it's less, you probably do have a rateable impairment. As far as the lower leg here, again, if you fractured the any of the bones down here, then if it heals as a deformity, it's probably a rateable impairment. As far as the knee is concerned, there's several impairments of the knee. There is any type of surgery, obviously. A couple of things that you can't really help with surgery. Sometimes if there's ligament laxity, you pull on this and it's really loose, or you turn side to side and it's really loose. Or if there's skin loss on the knee, and I'll demonstrate on Morgan here. She has skin loss here, and it prevents her from kneeling. Of course, she's not at maximum improvement, and that's probably will get better and won't have any problems. But if that's the case, and it's a chronic skin loss here, that's a rateable impairment. Range of motion, if the leg can't get all the way down, it's easy to tell. Just put your hands down here. Then there's probably a contracture, and that's a rateable impairment. As far as range of motion, we see if it goes all the way, same as the other knee. And if it's less, it's probably a rateable impairment. I'm trying to think what else. There's one more that's kind of a hidden impairment. If you have a lot of crepitus, which just have them go back and forth, and then you do it back and forth, and if you hear a lot of popping, grinding, and then the other knee doesn't have it. Okay, if that's followed, is that in conjunction with pain that's under the kneecap, and also with the injury being some sort of trauma to the front of the knee, then and that's a rateable impairment. If the patella is fractured, that's a rateable impairment. And as far as the hip is concerned, it's really tough to get a rateable impairment on the hip from range of motion. The motions in the guides book is pretty liberal as far as what kind of motion the hip does. So as far as that's all the way up, and then it's kind of hard to do, but you off the end of the table, and you do it backwards, and then outward, and then inward, and then there's rotation inward and rotation outward, actually. So compared to the other side, even if it's a little bit less than the opposite side, it's probably not a rateable impairment for range of motion of the hip. It's actually pretty rare to get range of motion impairment with hips. Now, as far as the whole leg is concerned in total, if the injured leg has atrophy, which means that this muscle here is less than the uninjured side, or if the calf is less than the uninjured side, that's a rateable impairment. And if there's a numbness of the leg, unless we can attribute it to a specific nerve, then it's really not a rateable impairment. Sometimes with the hip problems or knee problems, there'll be a little bit of numbness around the area, and that's kind of normal. That's really not a rateable impairment. Strength for the leg can be a rateable impairment. However, it's got to be the only thing that's there. Because, for example, if you had a meniscus repair, it makes the muscle weak down here. It could be because of the pain from the residual surgery. And let's see, as far as limping, some people have limps because of either the, well, it could be a combination of a whole mess of things. A limp in and of itself is usually not a rateable impairment. Sometimes it is if that's the only thing that's that the rater can find, but usually a limp in and of itself is not a rateable impairment. And that's about it. So, thanks.